Did you know that 1 billion people worldwide are vitamin D deficient, and 50% of the population is vitamin D insufficient? Despite the known importance of vitamin D, it's in few foods we eat. Your body produces it in the sunlight, and the further north you live, the less exposure you'll get during those cold winter months. With deficiency correlating to back pain and disc degeneration, sufficiency can mean less pain and improved outcomes. Approximately 80 to 90% of people in the United States will experience back pain at some point in their lives. In Minneapolis, a university clinic found that 93% of 150 patients presenting with nonspecific musculoskeletal pain were vitamin D deficient. Another study in Saudi Arabia found that after supplementation with vitamin D, patients who were experiencing low back pain reported improved symptoms. The study concluded that patients experiencing low back pain should be tested for vitamin D deficiency. Postmenopausal women have been found to be at an increased risk of developing vitamin D deficiency, and it's been found that postmenopausal women have a higher risk of disc degeneration than premenopausal women. In a study from menopause.org, it was found that men had higher disc degeneration rates than premenopausal women. After menopause, the results were a different story. By the time women reached postmenopausal age, they had developed more severe disc degeneration than their age-matched male peers. Disc degeneration was worse in the first 15 years after menopause onset. Vitamin D deficiency is sometimes asymptomatic and is commonly mistaken as symptoms of other conditions. Hair loss, fatigue, dizziness, and sleep difficulties are all signs of deficient levels of vitamin D in the bloodstream. If one or more of these symptoms trouble you, and if it is persistent, it is a good idea to get your vitamin D levels checked. Some chemical exposure can reduce vitamin D levels, including bisphenol A, or BPA, an endocrine-disrupting chemical. BPA is mostly found in polycarbonate plastic, as well as epoxy and vinyl ester resin. Unfortunately, BPA exposure is incredibly difficult to avoid. According to the Minnesota Department of Health, packaged food is the largest source of exposure. A study in Italy found that in an elderly population, higher BPA levels and urinary concentrations correlated with lower circulating vitamin D serum. While limited exposure levels are considered safe, continuous exposure is considered a problem due to the buildup of chemicals. While some regulations have been passed in different countries worldwide, it is important to stay mindful about potential exposure for our health. So how do we make sure our vitamin D levels are sufficient? The most widely known source of vitamin D is the sun. Our skin metabolizes ultraviolet rays into vitamin D, so spending some time outdoors is already a step to making sure your vitamin D levels are healthy. Another way is to add vitamin D-rich foods to your diet. Natural sources of vitamin D are various types of fish, cod liver oil, egg yolks, and mushrooms. Some cereals and orange juice are fortified with vitamin D. With the limited foods that have vitamin D, it can be difficult to make sure you meet the recommended daily value of 800 units a day. To be certain, you can also take vitamin D supplements. Vitamin D3 has been found to be easier to metabolize than vitamin D2. Your dosage may vary depending on whether you are vitamin D deficient or insufficient, and the typical largest dose without doctor recommendation is 4,000 units to 5,000 units. Thank you for watching. Check out the original article by Joyce Holman on easyhealthoptions.com, link in the description. If you liked this video, click the like button. And if you want to see more videos like this one, click subscribe.